Hello students, today we will discuss how to use needle holder and how to place needle over the needle holder and how to take a bite through the cut edges of the wound or tissue. So needle should be placed in the middle of the needle into the needle holder, and needle holder distal jaw where needle should be placed is from the junction at the junction of the proximal 2/3 and distal 1/3, and always lock the needle before using, otherwise needle will move and position will change and you will find difficult to get through the tissues. There are two important things you have to remember. One is grip, second thing is precision. So when you place the needle at the junction of proximal 2/3 and distal 1/3, you will have optimum grip and better precision. If you place more proximally, grip will be good, precision will be inadequate. If you place more distally, precision will be good, but grip will be inadequate. Needle may rotate, may slip off. So proximal 2/3, distal 1/3 is optimum place where you place the needle usually. Of course, it may vary depending on if in the depth you may change it. If it is proximal in the other angled tissues, you may change it. Now needle, once you take, always you have to lock the needle holder. That's very important, most basic thing. Once you lock the needle holder, needle bite should be taken perpendicular to the tissue, like this, perpendicular to the tissue. Then you have got the two edges of the wound. That is, so initial first bite always take through the entry point, and second bite it comes out of the other edge of the wound or tissue, that is called exit point. So exit point you have to take, entry point you have to take first, separately take, bring it out, need not take both entry point and exit point together. One by one you can take for convenience. Very convenient, and comfort is most important rather than struggling. Don't never struggle. Do a very precise and skilled job. Then take the needle bite from the both entry point and exit point. Now I will show how to do that. Now this is the needle holder. This is how exactly you will hold the needle, the ring finger, thumb, and this is the crisscross serration and groove here, and see proximal 2/3 and distal 1/3, and this is the where exactly you will place the needle. I am using 20 reverse cutting 45 mm circle, 3/8 circle, 45 mm needle. 20 reverse cutting 45 mm 3/8 circle needle I am using. I am using polyamide monofilament suture material which is black coated. So this is how exactly we will place the needle. This is important. 2/3 and 1/3. Now hold like this. You can always grip like this. Then take the dissecting forceps. I am using toothed one. I am holding like a pen. See that? Like a pen. There are serrations there. Over the serrations you have to hold over the serrations. Now suppose this is the wound. This is the wound. This is the entry point. You will hold like this. You will hold like this. This is the entry point. See that? Needle should enter perpendicular, not obliquely like this. Should enter perpendicular like this. Then always need not bring both sides together. Then bring it back. Then hold it like this. Pull properly. Then again hold the needle like this. Then come out of the exit point. So this is the exit point of the wound. See that? Like this. This is the exit point of the wound. And come out like this. And this is how exactly you will take the bite. And pull it, make it try to equal. This distance should be equal. So this is how exactly, this is the entry point, this is the exit point. Always perpendicular you have to go, and perpendicularly you have to come out. One by one you can take. Don't require to take the bite from exit point and entry point and exit point together. So that is how exactly you will take the bite. Needle should be locked always, remember. You should hold like this. Needle should be locked, and it should be parallel like this. And rotation movement. Rotation, not pushing movement. Rotation movement, not pushing movement. So that is how exactly you will take the bite from the tissue. Lock, perpendicular, entry point, exit point separately as your convenient and comfort, then bring out equal distance from each point. It's the most important thing, how to take needle bite. So I hope students, you have understood this one very clearly.